Vitamin B9, folic acid, water-soluble vitamin. The coenzyme form is tetrahydrofolic acid, short form THFA. Its main function is it is involved in the 1-carbon metabolism to give some such 1-carbon compounds like N5-formyl tetrahydrofolate, N10-formyl tetrahydrofolate, N5-methinyl tetrahydrofolate, N5, N10-methinyl tetrahydrofolate, as well as many others, which I have not mentioned here. So some of the main functions of tetrahydrofolate are it is needed for the synthesis of, first of all, purine ring, where it forms the C2 and C8 parts, and this purine ring will eventually give rise to the formation of DNA. Also, it's involved in the formation of N-formyl methionine, which will ultimately give way to the protein biosynthesis. Also, tetrahydrofolate needed for synthesis of choline, ethanolamine, methionine, etc. Folic acid deficiency associated disorders, very important, neural tube defect, especially in the pregnant mothers. That is why pregnant mothers are given special dose of folic acid separately. Also, folic acid deficiency will give rise to colon cancer, cervical cancer, macrocytic anemia, and this is important, coronary heart disease due to hyperhomocystinemia, which is treated by vitamin B6, B9 and B12. Folic acid recommended dietary allowance 200 microgram per day. It is increased in pregnancy. Folic acid deficiency test, how to detect? By the histidine load test or the FIGLU excretion test. FIGLU stands for formiminoglutamate acid. Name structural analogues of folic acid. One is trimethoprim, which is an antibiotic, and one is pyrimethamine, which is an antimalarial. Name inhibitors of dihydrofolate reductase, methotrexate, which is an anti-cancer drug, and trimethoprim, which is an antibiotic. So methotrexate and trimethoprim both act in a similar manner by the competitive inhibition of dihydrofolate reductase. Name some inhibitors of folate absorption from diet. Well, they are anticonvulsants, for example, phenobarbital and dilantin. So tetrahydrofolate is stored in the liver for 2 to 3 months. Folic acid better absorbed in which form? Monoglutamate form. Folic acid most potent in which form? In the polyglutamate form. Monoglutamate, polyglutamate. Thank you.